I was diagnosed with triple-negative breast cancer. Even young women can get breast cancer. You don't have to be old. You can get it before your time to have a mammogram.
It almost have been a year to the date that I had my mammogram, and they told me they found something that didn't look right. That's when we had to do the biopsy, and I was quite shocked.
Once you get through that initial shock, you know, getting a treatment plan laid out with people that you trust and moving forward, and so it can all be behind you in no time at all. Our patients do really well. Cancer is not a horrible, scary diagnosis. It's treatable like so many other diseases.
Well, I got pretty nervous, I'll say that. You know, I kept thinking, what if they get in there and it's bigger, and what if? And so I had the surgery, and they said everything went well, but I should do radiation. I went through the 16 treatments of that. From the radiation, I wasn't burned real bad at all. It was never real uncomfortable. It was like a piece of cake, actually. You know, I got tired, but now I'm going 90 to nothing. You know, at my age, I'll be 74 in December.
I was diagnosed on September 20th, 2021, and I began chemotherapy in early November. Chemo was very hard. I was in about 6 months. I learned I had to listen to my body a lot. I learned I had to not do as much and to kind of learn to depend on others. I did lose my hair, which was very hard. The surgery, the mastectomy itself wasn't as bad as what I thought it would be. I was able to recover faster from that. Dr. Henderson listened to me, and I advocated for myself, and she listened to every step.
We talk, we find out what they need, what they want, what their expectations are, what their lifestyle is. Every patient is an individual. Every disease is unique to that patient. Right? Your whole world can't stop just because you were diagnosed with cancer. You have children, you've got a job, you've got bills to pay. Life goes on even though your world suddenly is all about cancer.
Dr. Henderson was so good. She explained to me how things were, that it was contained. Everybody got on the ball, and we got the surgery over with. We got the radiation started. I have never had any soreness, any discomfort whatsoever. But I think if I'd waited longer, it would have been so much different. And I have a close friend that I've told her, you need your and she still hasn't gone. And if I could save one life because they would go and get a mammogram, it is worth it to me.
Between the ages of 35 and 40, we often get a baseline mammogram. 40, at least once a year was the recommendation.
30 minutes out of your day, once a year, is so important to have it done.
I was able to find my cancer at an early stage because of self-examinations.
I encourage girls to start self-exams, just because you get used to it. If you get in a pattern, you're doing it all the time, then as you get older, you'll know what your breasts feel like, and you'll know what the difference is.
It sounds scary, and people don't want to step forward into screenings and all that because they might find something. The truth is, the sooner you find something, the sooner we can fix it and get it out of your life.
If it hadn't been for that mammogram, I'd be in deep trouble. I do believe that.
I want people to know that I did not have a family history before I was diagnosed, and that had I not done the self-examinations and found it myself, I would have been probably stage 4 by the time it was found, or worse.